when common advice becomes dangerous. In an emergency, most people don't stop to think. They fall back on advice they've heard their entire life, tips from parents, friends, or family members. It feels safe because it's familiar. But here's the problem: a lot of that advice is outdated, and some of it can actually make the situation worse. Many first aid myths didn't come from science. They came from habits passed down over generations. People repeat them so often that no one questions them anymore. But emergencies don't care about tradition, they demand the right response. Take eye injuries as an example. If something sharp or solid gets into your eye, panic kicks in. People try to rub it out, rinse it aggressively, or remove it themselves. That reaction can cause permanent damage. In cases like this, the safest move is often doing nothing. Keep the eye still and get medical help immediately. On the other hand, if it's just dust or an eyelash, there's no need to panic. Clean hands, gentle blinking, and letting tears do the work is usually enough. Problems happen when people treat every situation the same way without understanding the risk. Wounds are another area where people get it wrong. Many believe applying ointment or cream right away helps healing. In reality, too much moisture can trap bacteria and slow recovery. A properly cleaned wound, covered with a dry bandage, often heals faster. The pattern is clear: panic plus bad advice equals danger. First aid isn't about doing more, it's about doing what's right. And that's just the start. The next mistake is something millions of people still do every year, without realizing how risky it really is. Stick around, because what's coming next might shock you. Fevers, fainting, and fixes that backfire. When someone has a fever, people rush to cool them down, but not always safely. One old school belief is rubbing the body with alcohol or vinegar. It sounds logical, but it's actually dangerous. These substances can be absorbed through the skin and enter the bloodstream, especially in children. A safer approach is hydration and airflow. Water, non-alcoholic drinks, and a cool room help the body regulate itself naturally. Sometimes, the best help is simply letting the body do its job. Fainting is another situation where instinct often fails. Many people think lifting the person up or splashing water on their face helps. In reality, standing them up too fast can make things worse. The brain needs blood flow, not sudden movement. The safer response is simple: lay them down, raise their legs, loosen tight clothing, and give them time. Once they wake up, avoid caffeine, it can cause dehydration. Burns are also full of dangerous myths. Butter, oil, or sour cream may feel soothing at first, but they trap heat inside the skin and increase damage. Cool running water helps release heat properly. And those blisters that form? They're there for a reason: they protect against infection. But things get even more dangerous when movies and social media get involved. The next mistake looks brave, but can permanently damage the body. Broken bones, sprains, and movie myths. Movies make resetting bones look heroic and easy. In real life, it's neither. Trying to fix a bone or joint without medical training can cause nerve damage, internal bleeding, or lifelong injury. Your job isn't to fix the injury, it's to keep it from getting worse. Immobilize the area, support nearby joints, and get medical help as fast as possible. Sprains are also misunderstood. Many people apply heat because it feels good, but in the first 48 hours, heat increases swelling. Cold therapy helps reduce inflammation, but only if used correctly. Ice should never touch bare skin and should only be applied for short periods. Many injuries become serious not because of the accident, but because of what people do afterward. And if injuries scare you, wait until poison or water is involved. One wrong move in the next situation doesn't just cause harm, it can cost a life. Poisoning, drowning, and panic decisions. Poisoning causes instant panic. One of the biggest myths is forcing vomiting. This can push toxins into the lungs or burn the throat again. In poisoning cases, the smartest move is calling emergency services immediately. Drowning is also widely misunderstood. It's often silent, not dramatic. If you try to rescue someone, approaching them incorrectly can put both lives at risk. Panic makes people grab and pull without thinking. Saving someone only works if you don't become the next victim. But blood changes everything. The next mistake looks heroic, but turns survivable injuries into deadly ones. Wounds, objects, and false heroism. Seeing an object stuck in a wound makes people want to pull it out, but that object might be stopping severe bleeding. Removing it can turn a survivable injury into a fatal one. Even doctors leave objects in place until surgery. The safest move is stabilizing the object and getting professional help. Bruises also invite mistakes. Ice helps, but only when used correctly. Too much time or direct contact can cause cold burns. And finally, we reach the mistake almost everyone still gets wrong even today: closing wounds and knowing when to stop. Stitches work, but they aren't always necessary. Small, clean cuts can sometimes be closed with medical skin adhesive. It's fast and less painful. But deep or large wounds should never be treated casually. The real skill in first aid isn't knowing how to fix everything, it's knowing when not to try. Because when emergencies happen, it's not about being brave, it's about being right. And knowing this might save a life someday, maybe even your own. Thanks for watching. Don't forget to subscribe for more real stories and life lessons only on Stroyzon. See you in the next story.